Radio, where debt is dumb and cash is king. Listen live weekdays at 1 on WMAY 92.7, 94.7, and 970 AM.
Back with the WMAY morning news feed. Governor J.B. Pritzker acting upon 80-some-odd bills on Friday. He changed an ethics bill that we'll talk with Lisa Kaplan from Reform for Illinois coming up. He outright vetoed another bill that deals with ambulance service. So joining us here on the WMAY morning news feed, I want to connect with Chris Vandenberg. He is with the Illinois State Association for Ambulances. Chris, thanks for taking time with us this morning. Let's go ahead and get your reaction here. Governor J.B. Pritzker vetoing this measure. What did it do, and what are you guys vowing to do?
Thanks, Greg. Appreciate your time this morning. House Bill 684 streamlined the processing of ambulance claims by moving it from managed care, the 5 different managed cares and their associated brokers, back to fee-for-service. We've been working for a number of years with Healthcare and Family Services and members of the General Assembly to try and resolve these problems with these managed cares. It's been probably more than 6 years that we've been having meetings on this, and ultimately the solution that we believe will continue to make sure that claims can get processed properly is to move it back to the state's fee-for-service program.
So the governor ultimately vetoing this, saying that he fears it would hurt availability and impact the most vulnerable. But this measure passed unanimously out of both chambers. What do you anticipate is going to happen with this?
Greg, for us, it's a challenge. What we really truly believe is that this is something that will ensure that ambulances are available. And ultimately, there were 62 House sponsors. There were 37 Senate sponsors, and it passed unanimously. And I think it's because the members of the General Assembly took the time to understand this issue, have heard from folks in their district. Ultimately, by not being able to pay ambulance companies, response times increase across the state, and it's ultimately because we can't continue to pay the EMTs and paramedics the wages that they need in order to do this. I think during the break here, we just heard an ad for Culver's offering $15 an hour. If somebody can go and work at Culver's and start tomorrow versus going to an EMT program, going to paramedic school and make the same amount of money, they're not going to do that. And that's really a genuine public health crisis. And so, that's really kind of what we're concerned about at this point.
Chris Vandenberg, he is the president of the Illinois State Ambulance Association, reacting to Governor J.B. Pritzker vetoing a measure that would deal with ambulance services. And this was House Bill 684. The governor vetoing that, ultimately saying that the addition of the language inadvertently could cause some problems with service. Chris, you had mentioned a bit about pay for EMTs, and this came up here on air when we were out at the state fair. We do a segment every Friday called Hero of the Week, and that week was, of course, with the fair being First Responder Day, and we took calls from all kinds of people who have first responders in their life. One woman shared how her daughter's a doctor, her son-in-law is an EMT, and he makes barely above minimum wage. How can we get a better handle on ensuring that these first responders, who a lot of times, even though you've got fire departments that may show up to a medical call, the fire department's not the one that's taking them to the hospital and filling out the paperwork for hours on end after that. It's the EMTs who are doing this, putting in those long hours. And if people haven't seen that Nicolas Cage movie back in the 90s, I forget what it's called, but it's pretty incredible to highlight the strain on EMTs, especially at some of the darkest hours of people's lives. What's the status of pay? How do we increase that? And is it a bullet that you think the public's willing to bite?
Greg, House Bill 684 was aimed right at fixing that problem. About 75% of an ambulance services revenues, we're told what we're going to be paid by the federal government through the Medicare program or by the state through the Medicaid program. Ultimately, that amount paid by the state right now is dramatically below cost. It's something on the order of less than 50% of the cost of providing the service. So that really affects our ability to pay these EMTs and paramedics, and particularly during a pandemic right now, the stress that they're facing on a day in, day out basis, just with the patients that they're seeing, the acuity, how sick the patients they're seeing are, but then also the added stress of being exposed to COVID. And while you may have the PPE and the necessary equipment to protect yourself, you're concerned about still bringing that home to your loved one at night. And ultimately, these folks are really truly the heroes right now. They're not only going and picking you up and bringing you to the hospital, but then they're also taking you to the next level of care, whether it's going back for rehabilitation after an illness, or it's going to a higher level of care if you become really sick and you need to go to another hospital. The fire departments don't show up and do that. This is where private EMS is really the focus of moving patients and continuing to make sure the system is available there. And 684 was one small step to try and at least make sure that the providers are getting paid for the transports they're doing instead of the money going to managed care. So it's trying to keep the money in the pockets of the first responders that are showing up and out of the pockets of the managed care organizations.
Chris Vandenberg, what's the next step here? I take it you guys are probably already on the phone with lawmakers. They're coming back tomorrow for a special session, and I know that there's a timeline, like a deadline of when they have to act once it's entered into the calendar. So is it crunch time for you guys, and do you anticipate this coming up for a possible override attempt tomorrow?
It's all hands on deck for us right now, working with our sponsors. As I said, we had 62 House sponsors, we had 37 Senate sponsors, and it was unanimously approved. The will of the General Assembly was expressed to the governor, and he chose to completely veto the bill. So we are going to be going back and working with all the members of the General Assembly to implore them the importance of this to protect frontline workers and make sure that there is money there for them over having the money at the managed cares.
Chris Vandenberg, president of the Illinois State Ambulance Association. Again, thanks for taking time with us today, and we'll track this and see how it plays out, all right?
Thanks. Have a great day. Take care.
You too. It is the WMAY morning news feed. Let's take a look at news. Kevin Hart standing by with the latest.
It's time to mask up again. The WMAY newsroom